Welcome to the EAU podcast series, Women in Urology, Dare to Thrive. In this 8th episode, Inclusivity Challenge, Creating Transformative Culture, we are joined by Dr. Joe Phillip and Dr. Silvia Proietti. Together, they will discuss how to move from awareness to action in building inclusive workplaces, addressing unconscious bias, and creating cultural change within urology. Join us as we embark on this informative journey.
Hello, everyone. Welcome to the European School of Urology podcast series, Women in Urology, Dare to Thrive. In today's episode, Inclusivity Challenges, Creating a Transformative Culture, we'll be exploring how we can move beyond representation to foster true belonging. We'll share personal perspectives, highlight the challenges we face, and discuss practical steps to make our organizations, workplaces, and leadership in urology more inclusive, equitable, and just. I'm Joe Phillip, consultant urologist at the Bristol Urological Institute in the United Kingdom and president-elect of the British Association of Urological Surgeons. Thank you to Amelia Pietropaolo for the invitation, and I'm delighted to be joined by Dr. Silvia Proietti, urologist at the San Raffaele Hospital in Milan, Italy, Deputy Director of the European Training Center there in endourology. Good morning, Silvia.
Good morning, Joe, dear colleagues. It's a great pleasure and honor for me to join this interesting podcast. Thank you very much for the invitation.
Thank you. Silvia, you've achieved so much as a surgeon, educator, and you are a true role model in urology. I'm sure that journey hasn't been without its challenges. Could you share with us some of your experiences and what has shaped your path?
So, Joe, my journey as a woman in urology in Italy has been characterized by challenges that, curiously, did not come from my colleagues, my mentors, or from the academic system, but from patients. Many patients were surprised, sometimes even doubtful, when they realized their surgeon was a woman. Some even questioned my abilities before I had the chance to show them my skills. For many of them, the image of surgeon was automatically a man. At the beginning, these were very difficult for me. I often felt I had to prove myself twice as much, not only in terms of surgical ability, but also in terms of authority and confidence. But over time, I learned to transform this challenge into an opportunity. By showing empathy, by explaining carefully, and by performing the surgery with competence, I slowly gained their trust. What struck me most was that after the initial hesitation, many patients actually became my strongest supporters. They would come back for follow-up with gratitude, and some even recommended me to their families and friends. This experience taught me something important. Inclusivity is not only about institutional policies, but also about changing mindsets. And sometimes that change happens one patient at a time. And you, Joe, what about your experience as a urologist in UK, coming from another country with a different cultures? Please tell us your experience. Thank you.
Thank you, Silvia. I mean, it's amazing how you made a change one patient at a time. Your journey has clearly been a challenging one, and all the more credit to you for achieving such high standards of surgical excellence. When I reflect on my path, I think back to arriving in the UK from India 27 years ago. I mean, at that time, my life seemed to revolve around a 2-year visa cycle and the uncertainty of whether, I would be able to progress to the next stage of training. The constant pressure was exhausting in itself, and then added to this were attitudes I encountered from patients, peers, and perhaps more disappointingly, some consultants in positions of influence. There were moments of discrimination, sometimes instances of overt racism, and a prevailing culture where women's rights were barely acknowledged. in what was a very male-dominated and entitled system. I mean, there was at one stage, a couple of years into my training, I was so disillusioned that I even considered giving up surgery and moving into something a little bit more inclusive, such as radiology. But what kept me going and ultimately kept me in urology were the allies I was fortunate enough to meet along the way. And I'm going to name drop, people like Shannon O'Rourke in Cornwall, Nigel Parr on the Wirral, Steve Payne in Manchester, colleagues who routinely recognized potential, who judged others by their hard work and merit rather than background, gender, or accent. It is interesting that their support and encouragement reminded me and continues to remind me that good people in leadership can make all the difference to younger medics trying to find their place. I mean, now looking back and where I am today, I'm proud that I stayed the course, but I'm also conscious of the privilege of having had those allies at crucial moments. Not everyone does. Not everyone is lucky. And while we have certainly come a long way in terms of inclusivity and equity, there is still so much more work to do. I mean, the responsibility is on all of us, men, women, minorities, majorities, especially those of us in leadership positions, to create environments where the next generation feels supported, valued, and able to thrive, regardless of their background or identity.
Wow,
Yes.
what an impressive story. You should
Thank
be
you.
super proud of yourself, and you truly deserve all the achievements you have reached over the years.
Thank you.
So, I have another question for you. What do you see as the main challenges we still face today when it comes to gender equity and cultural diversity in urology?
We still have a lot of work to do. We need to get the balance right also. If we want equity and representation, not just in urology, but in every walk of life, we first need to understand where we stand, and that means data. Data on our membership, our organizations, our workforce, and even on our patients. In the UK, PAUS, or the British Association of Urological Surgeons, has been leading the way. We now have demographic information for just about half of our members, which is quite good data. Of these, 38% are women, 32% identify as ethnic minorities, and 28% are overseas trained doctors. I mean, when it comes to patient demographics, the picture is far more variable, changing from region to region. I mean, you may ask, why does this matter? Because understanding the data, what it will do is help us see the gaps. Are we representing in leadership the membership? It helps us spot progress. Are we improving? And it allows us to design systems that enable inclusivity and more so equity through real representation. And I think when we get this right, everyone will benefit. The workforce culture becomes fairer, patient experience improves, because both patients and professionals will feel a powerful sense of belonging when they see themselves mirrored in the leadership, in the clinicians. I think our challenge is clear, Silvia, to make sure that the data doesn't just sit in reports, but is used to drive action. We need to turn numbers into real, lasting change that shapes the future of our specialty across all our countries. And people like you are leading the movement, are being real role models, and I'm privileged to sit here with you. What do you think are the challenges we face?
So, Joe, I perfectly agree with you what you said. And my experience in Italy showed me that inclusivity goes beyond numbers or statistics. It's about visibility and representation. When patients rarely see women in surgical roles, they unconsciously assume it is unusual or even inadequate. And this is where culture needs to be transformed. Representation really matters. The more women and diverse professionals are visible in leadership, surgery, in academic conferences, the more normal it becomes for society and for patients to accept us. In urology, we still face barriers, underrepresentation of women in senior positions, a lack of female mentors, and sometimes fine but persistent biases. These are not always openly expressed, but they affect career progression and confidence. And Joe, drawing on your extensive experience in guiding and supporting several trainees, what do you see as the key elements to building a transformative culture in our field?
Thank you, Silvia. It's interesting how your experience mirrors a lot of what we are trying to change. I mean, in BAUS in the UK, we've really tried to be at the forefront of change. A clear example I would like to share is how we have changed representation at our meetings. Not so long ago, less than 10% of our chairs or speakers were women or from ethnic minority backgrounds. Today, that figure is almost 40%, much more in line with our membership demographics. So the visibility is noticed. There is a buzz among membership. All the younger urologists know that if they are good, they will have representation. They are seeing that equity is not just a word, but a direction we are moving in. But numbers alone are not enough, I think. The message has to be heard. People need to know that organizations like the European School of Urology and BAUS are committed to empowering and recognizing leaders from groups that have historically been underrepresented. Women, ethnic minorities, and also those who are first in their family to go to the university. This group of people have not been recognized much in the past. This commitment also needs to be mirrored across hospital leaderships, the royal colleges, university boards, every walk of life, wherever we can make this change, the visibility, the importance of this known, then patients and allied health professionals must also hear this message. And together we all understand that we belong. And most importantly, and finally, I would like to say we must recognize and value the role of allies and ensure proportionate representation from the majority group as well. So that way everyone feels included in the journey and we create a culture of inclusivity that truly benefits all. The feel for belonging and the mirroring of ourselves in our leadership makes a big difference for all of us. What about you, Silvia?
So, Joe, first of all, thank you very much for sharing with us your valuable thoughts. In my opinion, to move from challenge to transformation, we need a cultural shift. For me, that means three key things. First, mentorship and role models. As a matter of fact, having visible women in senior surgical roles makes a huge difference. Young trainees must see that it is possible. Second, education. Both patients and colleagues need to be exposed to diversity to understand that the excellence is not linked to gender origin, but to competence and dedication. Third, daily actions. Transformation does not only come from institutional policies, but from the way each of us treats colleagues and patients every day. Respect, support, and encouragement build a more inclusive environment. Nevertheless, since I started working as a urologist, I have already witnessed a significant change. I am confident that step by step, this transformation will continue until the day when we will no longer need to speak about gender equity and inclusivity, because they will be a natural reality. And I feel really lucky because I had mentor as Guido Giusti and Professor Traxer who support me over the time and gave me the opportunity to show what I am able to do. So, as we need to close this conversation, I think that it's important to highlight three take-home messages. Inclusivity is not optional. It is essential for the progress of our specialty. Diversity, whether gender, culture, or background, makes urology stronger and more innovative. Transformation begins with small everyday actions, challenging stereotypes, supporting colleagues, and creating an environment where everyone feels they belong. So I would say that it's important to thank you for joining all of you today. And I also want to thank the EIU and Amelia Petropaolo for this wonderful podcast initiative. And also want to thank my friend Joe for co-hosting these episodes with me on such an important topic. I hope our discussion inspires you to reflect on your own experiences to take part in building a more inclusive and transformative culture in urology.
Thank you.
Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.